College London for our various courses, including medicine and dentistry, which I'll be talking about today. So I'm very happy to be speaking to you all, and I will go straight into the presentation. So applying to medicine and dentistry, as a university, we have over 175 courses, and that's many courses compared to a lot of universities. That's a lot of courses. So we do.
Henry, sorry to interrupt. Could you make the presentation bigger? Do you have it on presentation view?
Yeah.
Could you zoom it? Could you make it a bit bigger?
Okay, 1 second.
Yeah, thank you. And maybe because you can come a bit closer, because it's very small. You can move the chart if you want. Yeah, if you can. The students are just moving their chairs. Yeah, probably you can see them. Thank you.
Yeah. Is that okay?
Better? Yeah. Yes, it's okay. Thank you, Henry.
Yeah, I can continue now, yeah? All right, perfect. So like I was saying, we have over 175 courses that we offer at King's College London, which is quite a lot of courses. One of the things that we focus on is in interdisciplinary courses. So that is basically the ability to put two courses together. So it's not going to be quite, far away courses, but for example, this year we've introduced a course like psychology and criminology. So that is one of our USPs where we're able to kind of combine courses together. We receive over 60,000 applications, and we have a student body of around 60,000 people. So you can imagine that in 1 year, if we're receiving 60,000 applications, but we have a whole student body of 60,000, the amount of how competitive the university is. And 50% are for 14 courses. So there is a group of courses that we consider to be very popular, and medicine is one of them. So 50% of our applications actually come for just 14 of the 175 courses. And medicine is currently the third most applied for course at King's. So very, very competitive. And we have to also understand that it's not just competitive for those in the UK, but it's internationally recognized. So there are applications coming from all over the world. And dentistry currently is the 10th most applied for course at King's as well. There are around 4,000 applications each year for our 5-year undergraduate medical program. So medicine at King's is a 5-year program where you would undergo a combination of theoretical and practical lessons. And around 1,000 applications are selected for interview, and there are around 300 places available. So a very, very competitive course, one of our most competitive courses at King's. There are around 1,000 applications each year. Oh, sorry, no. So yeah, these are our degree pathways for our healthcare degrees. So we offer quite a range of different healthcare degrees, including biomedical engineering, medicine, midwifery, nursing, pharmacy, psychology, sports and exercise medical sciences, and physiotherapy, different kind of courses. And as you can see, the grade requirements are slightly different for each course, and they also differ in the number of years that you will be studying for. So some of them are 4 years, some of them are 5 years, but most of our degree courses or our healthcare degree courses are ranging between 4 to 5 years. And in terms of requirements for medicine, we are looking at A-star AA, including chemistry and biology. So chemistry and biology are courses that you must be doing at A level in order to apply for medicine at university at King's. And once you do have those courses at A level, then the grade requirements are A star and 2 A's. I don't know if there are any people doing access, or is it just A level?
Students, we have, I think, the pre-access. Daniel? Yeah. We have one pre-access student.
Okay, perfect. So then we also do accept access to HE as well. And the requirements for that would be 45 level 3 credits overall at 39 credits at distinction and 6 at merit. And it must be in medicine or dentistry. And it must include at least 15 level 3 credits in biology and 15 level 3 credits in chemistry awarded at distinction. So we do offer the chance for access students as well as A-level students to.
Do you require certain A levels?
Yes, chemistry and biology.
Chemistry and biology, right? Thanks.
Yes, you're welcome. And for dentistry is very much similar. It's A star AA, that are the requirements. Again, including biology and chemistry, in addition to one of biology, chemistry, physics, mathematics, or psychology being the third A level. And again, with dentistry, the same as medicine, we also accept access to HE as well, with the same qualifications of 45 level 3 credits overall at 39 credits at distinction and 6 at merit. So it's quite competitive, and each year the requirements are actually increasing because of the level of competitiveness. So we are expecting our students to always be at the top of their game, especially wanting to study something as competitive as medicine. As we all know, medicine is a very sought after degree course, and it's also a very sought after profession as well. And then these are the degree pathways. So even after finishing, you'll be able to go into different areas of medicine. If you want to do a postgraduate study, you can go to biochemistry, pharmacology, physiology, neuroscience, different types of different degree pathways that are also available for you as well. A maximum of 4 choices on UCAS form may be made for programs which lead to a professional qualification in medicine or dentistry. What we look for. So as I said, I keep on using the word competitive. King's is a very competitive university, and so we are looking for a certain type of candidate, looking for a certain type of student. And I'll start with suitably qualified. So qualified, obviously you haven't got a degree yet, but qualified even in your work experience and what you have done prior to applying for university. There must be a strong academic record as a science student. So that's why I said that biology and chemistry for medicine and for dentistry are non-negotiables in terms of what you should be studying at A level, because what we are looking for are for students that have a strong record as a science student. We are looking for students who have work experience and suitable skills in that area. So if you are looking to apply for dentistry and chemistry, I would definitely recommend that between now and then, you look to increase your skill set and your work experience portfolio by looking at work experience opportunities in those fields. We're looking for a genuine enthusiasm for the subject and profession. So what we do get a lot of the time are students who, when we ask them why you want to study medicine or why you want to become a dentist or a doctor or a nurse, we have a lot of students that don't really know why and might have a lot of external influence. For example, their parents are the ones forcing them to become doctors. And this is something that we would read into, because we need students that have a personal, genuine enthusiasm for the subject area that they're looking to study. Remember, you're going to be studying for 5 years. It's not going to be your parents studying for 5 years. It's going to be yourself. So there must be a very personal, genuine enthusiasm for the course. Values and behaviors expected within the medical profession. So when it comes to medicine, we actually have a facility in our university that is dedicated to leading activists in the area of healthcare and medicine. And one of them said that when it comes to the topic of healthcare and the subject of healthcare, it must not just be done with your theoretical mindset in terms of this is just a job, but it must be done with a genuine care and a love for humanity. So these are some of the values and behaviors that are expected from students within the medical profession, because at the end of the day, these are lives that will be presented to you that you have a duty of care for. We're expecting students to research into the subject and have knowledge. Even prior to studying at King's, you're expected to have a certain level of knowledge for the course that you're looking to study. And program-specific entry criteria, i.e. the UCAT as well, is expected of students. So the application form. The application form is divided into 5 areas. You have your personal information, you have your course choice, education information, employment information, personal statement, and reference. So those are the 5 areas that you would need to fill out whilst doing your application form. Now, when it comes to the personal statement, this is very important because it's one of the factors that distinguish students from one another. If we have students that get the same grades, we are now looking at the personal statement, the UCAT, the interview, all of these things to distinguish and differentiate students from one another. The personal statement is an opportunity for you to tell us what excites you about the chosen course. And this is why I was talking about the importance of knowing why you genuinely want to study the course you want to study. Helpful if applying for competitive courses. So your personal statement will be able to set you apart. And it must be targeted towards your profession. So not just your course, but your profession. So life after university. It's very important that as a medical student, you have an idea of what it is that you want to do after you finish studying. It's 4,000 characters for one side of A4 paper. And what to include in your personal statement. 75% relevant to academic pursuits in and outside of school or college. So that is super curricular activities are very important for you to mention in your personal statement. Key skills and competencies. So what makes you a very good candidate to become a medical student? Your rationale for studying medicine, which goes back to your genuineness and your personal desire and enthusiasm for studying the course. Work experience and placements. Do not forsake or underestimate the power of work experience. Even if it's for 2 weeks, you must mention it. Shadowing doctors, healthcare professionals, volunteer or even paid work within the healthcare setting are very important. Relevant extracurricular activities. So all extracurricular activities are relevant as long as you can link the extracurricular activity to the course you want to study. For example, there are certain skills that you would possess by being in a team, a sports team, that would now be applicable to the course you want to study. Being in a sports team might not be directly linked to medicine, but the skills that you would possess in that extracurricular activity can be applied to medicine. And what you've learned from your experiences as well must be included in your personal statement. So when applying for medicine, I'm sure most, if not all of you, are aware that you have to take the UCAT exam. And it's a way of differentiating between a number of good candidates. And it's required by most universities for medicine. And it's bookable from around June, and it will be taken between July and September. It focuses on cognitive powers and valuable attributes of healthcare professionals rather than the curriculum or science content. No particular threshold, but average of 650 is a good guideline in terms of a score. So if 650 is a guideline, then I would encourage you to aim to get a bit higher. And it's divided into 5 subject areas: verbal reasoning, decision-making, quantitative reasoning, abstract reasoning, and situational judgment. All of these things are very necessary when dealing with the lives of other people. As I said, when it comes to the healthcare sector, it's not just you yourself, it is the lives of other people that you are responsible. It is multiple choice questions, and you can't revise, but you should practice. different universities use it in different ways in terms of how to make their decisions. There's also going to be an interview process as well that you have to undergo. And what we will look to see in the interview is communication skills, how well you can communicate, your scientific knowledge, your ethical instincts, and your decision-making skills. So these are all the things that in your interviewer will be looking at in order to make their decision as well. The type of interviews vary. So we have different types of interviews that we conduct. Some of them are panel interviews where we have about 3 to 4 members of staff, both academic and non-academic staff, who would be on the interview panel, asking you questions and would be judging and weighing you from there. We have multiple mini interviews and we have group interviews as well. And it's also a chance for you to question as well the people on the panel. So you have the opportunity to ask questions to those on the panel as well, which is a very good tip. I would encourage, when you are called for an interview, that don't just allow them to ask you questions, but also ask questions in return. So prepare and practice questions that you would ask the interview panel is a really good tip. So how to prepare for these interviews? So panel interviews are good because they give you time to establish a rapport with your interviewer and really showcase why you are a great candidate, but you might find them more intimidating. So it's very important that you are confident and that you ask the right questions.
Sorry to interrupt. We are still seeing the slide. What are we looking for?
What? Oh, sorry. What are we looking for?
It didn't change.
What's the title of the slide?
What are we looking for?
Okay. That's right at the beginning.
Yeah.
Let me You see it from the beginning now, Kings?
Now we can see what we look for.
I'm gonna stop and then share again.
Yeah, let's try that.
Yeah,
okay,
what do you see?
Okay, now it's the right view, I think.
Okay. Is it moving? Is it moving?
Yeah, now we can see medicine requirements.
Okay,
yeah,
perfect.
we've covered that.
Okay, what we look for now?
Yeah. Yeah.
Okay. All right, and then personal statement.
Yeah. You cut.
Okay, so now we are here preparing for the panel interviews. So, like I said, an interview is a very good way for you to, showcase your confidence to the interview panel, which is going to be very helpful to you when it comes to becoming a medical student. It's more like a conversation. So don't see it like a job interview, but see it as a way to get to know one another. Expect to be interviewed by those with different links to a university. So that's as I said, it will be academic staff, non-academic staff, students as well may be in the interviews, and they'll last around 30 minutes. But the main tip I would give you when it comes to the interviews is that be confident and know that it's not a chance to be proven wrong, but it's a chance for you to prove yourself right. And how to stand out. Make sure you are familiar with your personal statement. Know what the university is looking for in its applicants and understand the university and their course. So do a lot of research when it comes to the interview stage. So what do interviewers look for? So one of the things that the interviewers are looking for is for academic ability and intellect. So as I said, we want to see that as a student, you have a level of knowledge you have a level of expertise that will be useful and relevant for you to be an effective medical student. We are looking for empathy, your ability to put yourself in the shoes of another so that you'll be able to serve them better. Initiative and resilience. The medical field is a very fast-paced environment, and there will be times where you would be under pressure and you would need to really use your initiative and your resilience. So it's all about having a never given up attitude. Communication skills, verbal and non-verbal. Remember, you're being read. Even as a nurse, as a doctor, your actions as well as your words are being judged. Effective learning styles. How effective can you be when it comes to the type of learning styles, practicals and theoretical as well. Mathematical reasoning, insight and integrity, teamwork, organization and problem solving, and ethical reasoning. What are we looking for? We are looking for those who can demonstrate sensitivity to the needs of others. Again, when it comes to the medical field, it's very important that you have a level of care and love for another person, for others. Then there needs to be empathy and sympathy within your bones. Understands the rights of the patient to be fully involved in decisions about their care. So asking them how they would like certain things to be done. What is the means in how they would like you to conduct a certain service? Can think of ways to help resolve a situation when emotional issues may cloud one's judgment. And somebody that understands the limit of their own knowledge and experience. So knowing when to seek from a more experienced voice and source. So our top tips include do your research. And research can range from, watching documentaries, reading articles, reading books, speaking to past students, current students, being on Twitter, signing up to certain forums. These are all part of doing your research. And if you need clarification, rather than attempting to answer a question you haven't fully understood, find somebody that knows the answer and can help you. Use online resources, i.e. the Medical Schools Council and the Medic Portal are great ways for you to keep your knowledge and your information up to date. Don't second guess the answer. Often there are no right answers, and it's your explanation that they're interested in. Prepare and practice, and most importantly, be yourself. Because at the end of the day, we want to see you for yourself and who you truly are. Where you would be situated is the Guy's campus. That is our healthcare campus in the center of London. And we have the opportunity to come and visit and have tours, campus tours, every Monday, Wednesday, and Thursday and Friday from 2:30 to 3:30 is your opportunity to come and do a campus tour so that you can see the site for yourself. Thank you very much. And if there are any questions, I'm happy to answer.
You are going to stop the recording.